Bladder Health, understanding gross and microscopic hematuria severity. Imagine seeing blood in your urine. That can be startling and confusing. Hematuria, or blood in the urine, is a sign that something may be happening in your urinary system. It's important to understand that hematuria can be classified into two main types: gross hematuria and microscopic hematuria. Each type tells us different things about your bladder health and requires a different level of attention. Gross hematuria is when you can see blood in your urine with your eyes. The urine might look bright red, pink, brown, or even tea-colored. This visible blood usually indicates a more significant problem in the urinary tract. It could be caused by infections, kidney stones, trauma, or even more serious issues like bladder cancer. Because of this, if you notice blood in your urine, especially if it lasts more than a day or is accompanied by pain or discomfort, it's essential to seek medical care promptly. Doctors will typically perform imaging tests like ultrasound or CT scans and may do a procedure called cystoscopy, where they look inside your bladder with a small camera to find the cause. Gross hematuria is considered high risk because it often signals serious conditions that need quick diagnosis and treatment. Microscopic hematuria, on the other hand, is blood that you cannot see with your eyes. It's only detected through laboratory tests, where a microscope shows 3 or more red blood cells per high-power field in a urine sample. Sometimes a urine dipstick test shows blood, but confirmation with microscopy is necessary because other substances can interfere with the test. Microscopic hematuria can be a sign of early or mild issues, but it can also be linked to more serious conditions like bladder or kidney cancer, especially in people with risk factors such as age, smoking history, or occupational exposures. It can also occur with kidney problems like glomerulonephritis, which involves inflammation of the kidney filters. The severity of microscopic hematuria depends on the context. If you have no symptoms and the blood is found incidentally during routine testing, your doctor might recommend monitoring over time. But if you have symptoms like pain, frequent urination, or signs of infection, further evaluation is needed. Doctors will often categorize microscopic hematuria into low, intermediate, or high risk based on your age, health history, and other factors. This helps decide whether you need more invasive tests like cystoscopy or imaging, or if watchful waiting is appropriate. To evaluate hematuria, healthcare providers usually start with urine microscopy to confirm the presence of blood and analyze the red blood cells. Imaging tests such as ultrasound or CT urography help visualize the upper urinary tract. Cystoscopy allows direct inspection of the bladder and urethra, which is especially important if gross hematuria is present or if you are at higher risk for bladder cancer. Sometimes urine cytology is used to look for abnormal or cancerous cells shed into the urine. Repeating tests over time can help determine if the blood persists or if it was a one-time finding. Understanding the severity of hematuria is key to protecting your bladder health. Visible blood in urine usually signals a more urgent need for investigation because it can be associated with serious conditions. Microscopic hematuria, while often less alarming, still warrants careful assessment, especially in people with risk factors for bladder cancer or kidney disease. Early detection of bladder cancer can significantly improve outcomes, which is why any blood in the urine should be evaluated by a healthcare professional. Remember, not all hematuria is caused by cancer. Infections, stones, or benign conditions are common causes. But thorough, evidence-based testing helps ensure that serious issues are caught early and managed appropriately. If you notice any blood in your urine, don't delay seeking medical advice. A healthcare professional can perform the necessary tests, interpret the results, and guide you on the best next steps. Every person's situation is unique, and personalized care is essential. Hematuria is a warning sign that your body is trying to tell you something, and proper evaluation can help keep your bladder healthy and catch any problems early.